May I ask you to sit down as quickly as possible, please, because we want to proceed with our welcome addresses. Dear guests, I would like to welcome you to the third International Conference on Improving Use of Medicines to Antalya on behalf of the National and International Committee. In this session, we are going to listen to welcome addresses, and our first speaker will be John Chalker on behalf of the International Organizing Committee. Yes, please.
Welcome everyone. As you know, the second Isium was 7 years and 7 days after the first one. And for some reason, 7 came into our thinking, and so we were going to have the third one 7 years and 7 days after the second one. And as you know, that actually went wrong because of troubles in Egypt. So it's very sad for all the Egyptians that did such great work, and I should really thank the Eastern Mediterranean Region Office of WHO and the University of Alexandria and the Bibliotheca Alexandrina for all the work they've done. But luckily it's not completely wasted, because there are 2 groups of mini-Isiums going on in Alexandria right now, and with any luck they can see me waving to them, and they will join us in this room for the week. So that's great. But so we were lost. We had nowhere to go, and luckily WHO Euro, the Ministry of Health of Turkey, and the National Office of WHO, they said, why don't you come to Turkey? We can arrange it, no problem at all. So great thanks to them. And they also introduced us to Via Tours, who are the people who have done all the organization of this wonderful graphics and organization that you've seen about. So great thanks to them. And by great good chance, it's 7 years and 7 months. It might even be 7 years, 7 months and 7 days after the first one. So we've still kept the 7. Somebody asked me, why 7? And I said, well, I don't know. It's a nice number. 7. I guess the people I should thank the most, really, are you the participants, for coming. I guess we've got about 24 hours of different jet lags sitting in the room at the moment. I think we've got something like 600, we're going to have something like 600 people from 78 countries here today. So it's a fantastic gathering with huge amounts of knowledge, expertise, and experience. So that's what it is, I think. That's why we're here, to share that. The real meaning of Isium is that in extending the family of those interested in improving use of medicines. So that's great. I guess we should remember the poor people who were refused visas and couldn't get here, but luckily there was only about 4 or 5 of those in the end. So there's only just 4 or 5 people who couldn't make it out of 600. So it's not a bad percentage. I ought to thank, above all, I ought to thank the funders. The Swedish International Cooperation Agency, without them, this Isium would not have been possible. They showed faith in this from the beginning, and they extended when it went wrong and when it got delayed. They've been fantastic. So CEDA has been great, but there have been a lot of others as well. The Ministry of Health of Oman has been a great supporter. The United States Agency for International Development, the Department for International Development of DFID from the UK. The World Health Organization, Department of Essential Medicines and Pharmaceutical Policies, and 4 of the regions, WHO regions, between them have provided probably 70 or 80 scholarships to people here, EMRO, Euro, and CRO in particular, so that's great. Also REACT and Merck, Novartis, our official airlines, Turkish Airlines, and the conference-based web tool, which you've all used in order to register for the conference. And also you, every one of you who've actually paid your registration fee. A whole amount of that registration fee has gone towards scholarships for people from who were not able to afford to come otherwise. So thank you as well, the registration fee payers. I think between all of those, we've managed to fund something like 200 scholarships altogether, including WHO. So something like 1 in 3 of the people here, which is a fantastic achievement. You know, when we started off, we thought we might manage about 40 or 50. So it's brilliant. We should also record our thanks and appreciation for all the people who've done so much work to get here, to organize this. I think there's something like 60 people here who've been organizing the tracks, the track teams, and thanks. Without you, it couldn't have happened. And then all the people who've done all the millions of little things that need doing, preparing the books, the booklets, etc., etc. I was looking at my emails, and I mean, the curse of the modern day. And since the 1st of March, I thought this is one indicator of who's been doing most work around here. And I've had about 300 emails each from each of the 3 main Via Tours people, Serkan, Tariq, and Bengi. I've had 622 emails from Anita Wagner, the chair of the scientific committee. She's obviously been doing something. I've had 814 emails from Catherine Vial-Valentin. Where is Catherine? But the one who really takes it is I've had 1,315 emails from Lewis Parrish. The thing about ISTIM is it's a really participative event. We've got 140 people moderating or rapporteuring. We've got 229 oral presentations. We've got 37 plenary presentations. We've got, I don't know, I've lost count, but I think it's 588 posters. So actually almost everybody is doing something. It's a really participative and exciting event. So we have a treat in store over the next 5 days. So on behalf of the organizing committee, thank you very much and welcome.
Thank you very much. I'm sure you're not going to open your internet after the conference for a while. Thanks a lot. Now we are going to listen to Dr. Hanifi Özbek from Ministry of Health on behalf of the Minister. He is the Deputy General Manager of the Directorate of Pharmaceuticals and Pharmacy.
Kıymetli konuklar, ülkemize ve güzel Antalya'mıza hoş geldiniz. Bu büyük ve anlamlı organizasyonun ülkemizde gerçekleşmesinden dolayı büyük bir mutluluk duymaktayız. Bildiğiniz gibi maalesef 2 hafta kadar önce Van ilimizde ağır bir deprem meydana geldi. Bütün dünya bu konuda büyük duyarlılık gösterdi. Bundan memnuniyet duyuyoruz. Sayın Bakanımız bu nedenle toplantıya katılamadılar. Kendileri depremle ilgili çalışmalar içerisinde bizzat bulunuyorlar. Bu nedenle siz değerli konuklarımıza selamlarını iletmemi istediler benden. Şu an Mısır'dan da kardeşlerimizin bizi canlı olarak izlediklerini öğrenmiş bulunuyorum. Buradan bütün Mısırlı kardeşlerimize selam ve saygılarımızı gönderiyorum. Bu toplantının düzenlenmesinde emeği geçen herkese teşekkür eder. Toplantının verimli ve güzel bir şekilde sona ermesini saygılarımla arz ediyorum efendim.
Thank you very much. I was informed, I know it's a bit late, but there will be some Turkish presentations, so there are earphones for translation. You can collect them from the desks available in the hall. Now I would like to invite Dr. Riza Murat Karasen, who is the General Manager of General Health Insurance in Turkey.
Sayın Başkan, yurt dışından gelen değerli misafirler, değerli katılımcılar, ilaç kullanımının geliştirilmesine yönelik böyle kapsamlı uluslararası bir konferansı düzenleyen, başta Dünya Sağlık Örgütü ve Türkiye Cumhuriyeti Sağlık Bakanlığı olmak üzere tüm taraflara şükranlarımı sunuyorum. Geri ödeme kurumu olarak akılcı ilaç kullanımı gibi çok önemsediğimiz ve gündemimizde olan konuda bizlere de burada kendimizi ifade etme fırsatı verdiğiniz için ayrıca teşekkürlerimi arz ediyorum. Değerli katılımcılar, ülkemizde özellikle son 9 yılda sağlık hizmetlerinde adeta devrim niteliğinde çok önemli gelişmeler yaşanmıştır. 2012 yılı başı itibariyle tüm vatandaşlarını genel sağlık sigortası kapsamı içine alacak olan ülkemizde 2002 yılında sağlık hizmetleriyle ilgili memnuniyet %40 iken bugün 2011 yılında %80'lere, ilaç alımı ile ilgili işlemlerdeki memnuniyet %40'lardan %90'lara ulaşmıştır. Sağlığa bütçeden ayrılan pay oranı önemli derecede artmış, her geçen gün gelişmişlik düzeyi artan ve buna bağlı olarak bütçesi büyüyen ülkemizin dolayısıyla orandan ziyade sağlığa harcadığı para miktarı çok yüksek derecede artmıştır. Nitekim 2002 yılında sağlığa yaklaşık 10 milyar Türk lirası harcanırken bu miktar 2008 yılında 32 milyar Türk lirasına ulaşmış ve nihayet 2011 yılında bu yaklaşık 46 milyar Türk lirasını bulacağı tahmin edilmektedir. Ancak sağlığa harcanan miktar içinde ilaca harcanan pay ise her ne kadar oran olarak yıllar içinde azalsa dahi miktar olarak gün geçtikçe artmakta. Nitekim 2008 yılında bu oran sağlığa harcanan miktar içindeki ilaca harcanan pay %40 civarlarındayken 2011 yılında ise bu oran %36 olarak gerçekleşmesi beklenmektedir. Ki bu oran gelişmiş ülkelerdeki oranlara göre halen yüksektir. Biz bu oranları %25'lerin altına çekmek ve diğer sağlık harcamalarına daha fazla pay ayırmak niyetinde ve gayretinde olacağımızı buradan belirtmek isterim. İlaca harcanan payı düşürürken bunu tabii ki asla kısıtlama veya ulaşımı zorlaştırma yolunu seçmeyeceğiz. Bunun ancak akılcı ilaç kullanımı ile sağlanacağının bilincinde ve kararında olduğunun altını çizmek isterim. Değerli katılımcılar, Dünya Sağlık Örgütü 1985'te Nairobi'de oluşturduğu kısa tanımda akılcı ilaç kullanımını ilaca uygun doz ve sürede klinik bulgulara ve bireysel özelliklere uygun en düşük fiyata kolayca ulaşılabilmesi olarak belirlenmiştir. Yanlış, gereksiz ve yüksek maliyetli ilaç kullanımı tüm dünyanın olduğu gibi bizim ülkemizin de ciddi bir sorunudur. Yanlış tüketime bağlı olarak en önemli bir başka sorun ise yüklü maliyetin yanı sıra özellikle antibiyotiklerde direncin gelişmesi söz konusudur ve bu bir bilimsel gerçektir. Bir diğer önemli sorun ise ilacın yan etkilerinin veya doz aşımına bağlı morbidite ve mortalite artışı ve buna bağlı olarak maliyet artışıdır. Ülkemizin ilaç tüketimi ile ilgili yapılan birkaç çalışma konusunda sizlere çarpıcı bilgiler sunmak isterim. Gelişmiş ülkelerde reçete edilen birinci sıradaki ilaç kardiyovasküler hastalıklar ilaçları iken bizim ülkemizde birinci sırada antibiyotikler, ikinci sırada ağrı kesiciler gelmektedir. Ayrıca 2000'li yılların başında yapılan bir takım bilimsel çalışmalarda yaklaşık her iki ilaçtan birisinin irrasyonel ilaç olduğu ortaya konmuştur. Bir başka çalışma 2005 yılında yapılan evlerinde kullanılmayan ilaç olan vatandaş oranı yaklaşık %30-45 bandı arasında olduğu belirlenmiştir. Antibiyotiklerin gerekli olmayan durumlarda reçete edilmesi ve daha da olumsuz olarak halkın kendi kendine antibiyotik kullanması, antibiyotiklere direnci arttırmakta, dirençli ajanların oluşturduğu enfeksiyonların tedavisi güçleşmekte, ek olarak ekonomik kayba neden olmaktadır. Son olarak akılcı ilaç kullanımının önemini ortaya koyması açısından Şubat 2011 tarihinde sonuçlanan çarpıcı bir başka çalışmadan bahsetmek istiyorum. Toplumda antibiyotik kullanımı sıklığı ve hekimin antibiyotik reçete etmesinin etmenlerini ortaya koyan bir çalışma. Yaklaşık 4200 kişi üzerinde yapılmış bu çalışma. Ayrıca bu çalışmaya 80 aile hekimi ve 80 uzman hekim dahil edilmiştir. Bu çalışmalarda şu sonuçlar elde edilmiş. Bu kişilerin %25'i evde ileride gerekli olur düşüncesiyle antibiyotik bulundurduğu, yaklaşık %17'sinin hekimden antibiyotik istediği reçete etmesi için, %7'sinin çevresindekilere antibiyotik kullanmasını tavsiye ettiği, %26'sının kendi kendine doktor tavsiyesi olmadan antibiyotik kullandığı ve son bir yıl içinde yaklaşık %57'sinin bir antibiyotiği kullandığı ortaya çıkmıştır. Bu kişilerin yaklaşık %20'si hekimden istediği ilacı yazmasını, yaklaşık yarısının son bir yıl içinde kendiliğinden ilaç kullandığı ve %56'sının da kullandığı veya doktorun daha önce yazdığı antibiyotiği tekrar yazmasını talep ettiği bu çalışmada ortaya çıkmıştır. Ayrıca hekimlerin de yaklaşık yarısı tanı ve tedavi rehberlerini kullanmadığı veya yaklaşık %70'inin antibiyotik reçete ederken rehber kullanmadıkları ifade etmişler. Hekimlerin %60'ı ise akılcı ilaç kullanımı konusunda eğitim almak istemişler. Değerli katılımcılar, tüm bu bilgilerin akılcı ilaç kullanımının bizim için kaçınılmaz olduğunu ortaya koyması açısından yeterli olduğunu düşünüyorum. Dolayısıyla biz geri ödeme kurumu olarak akılcı ilaç kullanımı konusunda kararlıyız. Neler yapmalıyız? Tabii ki birinci sırada eğitim olmalı. Başta Sağlık Bakanlığımız ve Yüksek Öğrenim Kurumumuz olmak üzere tüm kurum ve kuruluşlarla sıkı işbirliği içinde hem ilacı kullanan halka yönelik hem de sağlık çalışanlarına yönelik eğitimlere çok ağırlık vermeliyiz. Halkın ilaç tüketimi ile ilgili eğitimi ve bilinçlendirmesi sayesinde farkındalık oluşturmak ama daha önemlisi hekimler, eczacılar olmak üzere sağlık çalışanlarına yönelik mezuniyet öncesi ve sonrası eğitimleri çok önemsemeliyiz. Kanıta dayalı tıp eğitimi, ilaç kullanım rehberi eğitimleri ve bu rehberlerin kullanımının teşvik edilmesi, farmakoterapi, farmakoekonomi eğitimleri, tanı tedavi rehberlerinin sürekli güncellenmesi ve kullanımına yönelik eğitimler, tedavi algoritmalarının oluşturulması şeklinde sayabiliriz. İkinci sırada ise irrasyonel ilaç kullanımının önüne geçilmesi, reçetesiz ilaç kullanımının önüne geçilmesi, engellenmesi, hasta ile ilaç arasındaki ambalaj, renk, isim gibi psikolojik bağların ortadan kaldırılması. Tabii ki biz geri ödeme kurumu olarak da yapmaya kararlı olduğumuz akılcı ilaç kullanımına yönelik bir takım tedbirlerimiz var. Öncelikle şunu belirtmek isterim ki, Genel Müdürlüğümüz bünyesinde akılcı ilaç kullanımı konusunda Devlet Planlama Teşkilatı projesi hazırlamış bulunmaktayız. Ayrıca pozitif ve negatif ilaç ödeme listelerinin belirlenmesi ve güncellenmesinde akılcı uygulamaya dikkat etmek, data madenciliği sayesinde risk odaklı denetim modelleriyle çalışmalarımız son aşamaya gelmiş ve bu sayede ilaç kullanımının takibi, denetimi, geri bildirimini sağlayacak ve böylece hekim, eczacı, ilaç üçgeninde irrasyonel ilaç kullanımını etkileyen unsurlar varsa bunlar bilimsel olarak ortaya konacak ve önüne geçilecektir. Uzun vadede ise hastalık maliyetlerinin ve içerisinde ilaç maliyetlerinin belirlenmesi, ilaç, özellikle de antibiyotiklerin yazım ve kullanım ilkelerinin belirlenmesi ve bunlara bağlı olarak geri ödeme politikalarının belirlenmesi olacaktır. Ayrıca uzun vadede ilaç İlacın kutu ve piyasa isim uygulaması yerine etken madde ve doz uygulaması yöntemine de geçilmesi gerekecektir. Bu vesileyle sözlerime burada son verirken bu toplantıyı organize eden ve bize de kendimizi ifade etme şansı veren tüm taraflara şükranlarımız arz ediyor. Uluslararası katılımcılara ülkemize hoş geldiniz diyorum. Başarılı, verimli bir konferans diliyor, saygılar sunuyorum.
Thank you very much, Dr. Karasen. Now, Zsuzsanna Jakab, who is the Regional Director of WHO Euro region, is going to participate by video to our meeting, and she's going to deliver her welcome address.
Of Turkey and Oman, Dr. Gezairy, colleagues and friends, ladies and gentlemen. I am honored and privileged to welcome you all to the 3rd International Conference on Improving the Use of Medicines, and let me especially acknowledge the organizing committee and the Turkish authorities for organizing this major conference at such a short notice. The International Conference on Improving the Use of Medicines, in its 7th-year edition, has become a major global event on the rational use of medicines. It brings together more than 500 policymakers, health professionals, consumer and patient organizations, industry and academia to discuss the complex issues around the rational use of medicines. It discusses the growing evidence base around interventions and policies and formulates recommendations for further research and for action to improve the use of medicines. WHO has a long history in working on the rational use of medicines, which started in 1985 at the Nairobi Conference, and in the following 25 years, much work was done around the WHO Essential Medicines List, the WHO Model Formulary, the guidelines for hospital drug committees, the Guide to Good Prescribing that introduced the problem-based pharmacotherapy teaching in the universities, the guidelines on patient information, just to name a few. In spite of all these efforts, inappropriate use of medicines continues in all countries in the world to some degree. Drug utilization research shows that between 20 to 60% of medicines are not appropriately prescribed and used, a staggering figure, especially if financial consequences and patient safety is taken into account. The use of medicines is subject to a much more complex interplay of many factors. In many countries, medicines are simply not available in pharmacies or in the health services. So how could the patient get the right drug? Patients do not have money to buy medicines prescribed by the doctors, or prices of the medicines are too high to be afforded by patients. Or patients may only have money to buy antibiotics for 1 or 2 days, thus not having a full treatment, giving rise to antibiotic resistance. The list is long, and it shows the complex interactions between the clinical science, the health system environment, and the economic, legal, cultural environment, and the behavioral issues that influence how individual patients make their decisions on if and how to take their medicines. All these issues will be discussed in the coming days of this high-level conference, and we look forward to expand our collective knowledge on how we can improve the use of medicines and on interventions and policies that work. In WHO Europe, we are currently in the process of shaping a new European health policy, Health 2020, where we look at health in a broader context, and we will focus on the social determinants of health and health inequalities and what the health sector can do together with other sectors in reducing inequalities and produce better health outcomes. We are also revitalizing public health in Europe, and in that respect, the regulation of the efficacy, safety, and quality of medicines in Europe is of key importance. We have also just adopted our European strategy and action plan on the prevention and control of non-communicable diseases, in line with the World Health Assembly discussions and the recent UN high-level meeting on NCDs. Our work on health systems is guided by the Tallinn Charter on Health Systems Development, the World Health Assembly and Regional Committee resolutions, and the recent World Health Report on universal coverage. Our recent Regional Committee, held in Baku, adopted the new action plans on HIV/AIDS and MDR-TB, two areas with an enormous disease burden in Eastern Europe. Furthermore, we also adopted a European strategy on antimicrobial resistance. In all these areas, the equitable access to medicines and their appropriate use is critical in order to save lives, improve health, and prevent the spread of diseases. Ladies and gentlemen, your area of work is of paramount relevance. Without medicines, our strategies are doomed to fail. In the European region, countries in Western Europe spend around 10%, while countries in Eastern Europe 40% of their healthcare expenditures on medicines. Whereas in Western Europe, the medicines are largely paid through the national health system, in Eastern Europe, it is often the patient himself who has to pay for the medicines directly. This leads to problems of accessibility and catastrophic expenditures for families, poverty, and inequalities. Our office continues to collaborate with member states on improving the use of medicines by supporting the development of formularies and clinical guidelines using evidence-based medicines approaches. We work with countries on medicines use in hospitals. We have established collaboration with the National Institute of Health and Clinical Excellence in the UK and reviewed their clinical guidelines program. We have worked with the Institute for Quality and Efficiency in Healthcare in Germany and reviewed their health information program that aims at providing patients with objective and non-directive information on diseases and treatments. Ladies and gentlemen, we look for your guidance on how we can further strengthen our efforts with our member states and all our partners, and how we can jointly ensure that medicines are well used at an affordable cost for the health system and for the patients, and that patients benefit from their treatment. Let me thank again our co-organizing partners, the Harvard Medical School, the Boston University School of Public Health, the Karolinska Institute, the Management Sciences for Health, the INRAD International Network for the Rational Use of Drugs, the Health Economics and Policy Association in Turkey, and my WHO colleagues for putting together an excellent program, and a great thank you to the Turkish authorities for hosting the meeting. We wish you fruitful discussions, and above all, we hope that you will be able to come up with further concrete policy recommendations that will help health systems throughout the world to improve the prescribing and use of medicines, and therewith to improve the health of the people. Thank you very much for your attention, and wish you a successful conference.
We also thank to Dr. Jakab for her welcome address. Now I would like to invite Dr. Mohamed bin Shahna from WHO EMRO office to deliver the welcome address of Hussein Abdel-Razzak Al-Gezairy, who is the Regional Director of EMRO World Health Organization.
Thank you. Good afternoon, everyone. Bismillahir Rahmanir Rahim. Distinguished participants, dear colleagues, ladies and gentlemen, I would like to welcome all of you to this important event which takes place every 7 years, the International Conference of Improving Use of Medicines, ICIUM. This, which is unique in its approach to identifying solutions by stimulating research in developing countries and structuring discussions to build towards concrete and robust actions at international, national, and subnational levels. The achievements of the two previous conferences of 1997 and 2004 are widely acknowledged and led to high expectations from this gathering of researchers, policymakers, practitioners, and other esteemed individuals with interest in improving the way we use medicines. The importance of this event arises from the bleak global picture regarding rational use of medicines and the difficulties in achieving significant impact in this vital area. The World Health Organization estimates that more than half of all medicines are prescribed, dispensed, or sold inappropriately. In addition to that, half of all patients fail to take their medicines or medications correctly. The overuse, underuse, or misuse of medications or medicines results in wastage of scarce resources and widespread health hazards. In 2011, we had planned to host the conference in the historical Biblioteca Alexandrina in Alexandria, in Egypt, in April 2011. Preparations for the event started in early 2009 and continued until early 2011. This included several preparatory visits by the third ECIUM international and local organizing committees, and numerous local events. The process led to the mobilization of the research community around the theme of improving use of medicines, and media events contributed to raising public awareness. This in its own was a great benefit already harvested. Following the events in Egypt and our region of January 2011, the decision was made to delay the conference and host it here in Antalya. Unfortunately, I could not be with you here in Antalya, but I am very pleased to welcome such wide participation, especially from the WHO Eastern Mediterranean region. With the support of our member states, the hard work of our staff, the cooperation of the ECIUM international organizing and scientific committees, and most important, the dedication of researchers, it has been possible to secure a significant number of scholarships from the Eastern Mediterranean region. I would like to thank our host, the government of Turkey, for welcoming this international gathering. For scholarships from Alexandria and other Egyptian governorates who were not able to come here to be with us in this ECIUM in Antalya, we are pleased to be able to connect them through live webcasting. A national event has been arranged in Alexandria in collaboration with the University of Alexandria, the local organizing committee, and other partners. I extend my best regards to those following the conference in Alexandria, and I think they are watching us through the technology. So I extend my best regards to those following the conferences in Alexandria and wish them a successful and meaningful exchange of experience and ideas. From the Eastern Mediterranean region, we are also proud to have an example of good practice of promoting rational use of medicines. In the Sultanate of Oman, His Excellency the Minister of Health, Dr. Ahmed Saidi, will chair a special session which focuses on national policies, programs, and systems. It is worth mentioning that the Executive Board of the Health Ministers' Councils for Gulf Cooperation Council states and the World Health Organization Regional Office of the Eastern Mediterranean region are signatories to a protocol of cooperation focusing on the rational use of medicines in member countries of the Gulf Cooperation Council, GCC. These are 7 countries in the Arabian Peninsula between the Red Sea and the Gulf. These countries are Saudi Arabia, Kuwait, Qatar, Bahrain, United Arab Emirates, Sultanate of Oman, in addition to the Republic of Yemen. In 2010, both parties organized a technical workshop on the rational use of medicines, and several important recommendations were adopted by the meeting of the Health Ministers' Councils for GCC states in Doha, February 2011. Dear colleagues, during the conference, you will have the opportunity to explore health system at different levels and understand where changes to improve medicines use take place. Discussions will be framed around global, national, international, and global, national, institutional, and individual levels. Your input and active engagement is indispensable for reaching consensus on future steps and proposed interventions that are practical and of high potential to improve the use of medicines. Finally, I would like to thank all of you who made these meetings possible and wish you a fruitful conference. Thank you.
Thank you very much, Dr. bin Shahna. Now, I would like to invite His Excellency Dr. Ahmed bin Mohamed bin Obaid al-Saidi, the Minister of Health, Sultanate of Oman.
Dear colleagues, ladies and gentlemen, let me start with thanking the organizing committee and our friends, colleagues, and brother, the Turkish Authority, for hosting this conference in this beautiful city. It's a great pleasure and honor to be with you here today in the 3rd ICM. I'm intending to share with you some of the stories about success in healthcare in Oman. But let me first introduce you to Oman. Dr. Mohamed mentioned it's part of the GCC, one of the GCC countries. It's a country with an area of half that area of Turkey, which is about 320,000 square meters. The population is just over 3 million. 1/3 of the population is expatriate. The Ministry of Health provides 80% of the health care for the country, and it is free of charge for all the Omanis and the expatriates who are working for the government. There are some other government agencies as well which provide free health care: Sultan Qaboos University, Armed Forces, and the police. We have a growing private sector which is expanding in the country, which is making it difficult to regulate as well. The demand for health care in Oman is quite high. I've mentioned the population is only 3 million and 2 million only Omanis, but in the year 2010, there were over 12 million visits to our outpatient clinics. That's an average 6 visits per each individual in Oman. Unfortunately, this is due to lack of education or health education. Oman had made great success in health over the last 40 years. Let me just give you some figures and examples. In 1970, we had 2 hospitals, one of them missionary hospital, 12 doctors, less than 30 nurses in the country. Now we have, for the government, more than 60 hospitals, more than 227 health centers and polyclinics, over 5,000 doctors, over 12,000 nurses, and 2,700 pharmacists and assistant pharmacists. The life expectancy in Oman in 1970 was 51 years for ladies and 49 for men. Within less than 30 years of His Majesty taking over, the life expectancy for women jumped to 74 years, and for men it was 71 years. They kill us and they live after us, ladies. Infant mortality in the 70s was 118 deaths per 1,000 births in Oman. And children less than 5 years old, the death was 181 for each 1,000 live births. Now it is 9 and 12 respectively, 9 and 12. Thank you. The vaccination rate is between 99 and 100 for the country. We eradicated polio and malaria, which was a killer in Oman. Now we have less than 1,000 cases a year, which is imported, most of it from our neighbors in East Africa. Ladies and gentlemen, one of the top 10 recommendations of WHO for achieving rational use in medicine is to have a body working at the national level in prescribing medications. The World Health Assembly has ratified and adopted such resolution in 2007. I'm very proud and pleased to say that the Directorate of Rational Use of Medicine was established in Oman in the year 2000, i.e. 7 years before it was ratified. I've mentioned about the successes in health services that we've had, but we are faced with many challenges like many health sectors worldwide. But our most important and difficult challenge is human resources. 70% of our doctors are expatriate. They come from different countries with different background, different training, different prescribing and dispensing habits. What we do to overcome one of the difficulties with our colleagues and friends from different countries, all doctors who come to work in Oman, they have to pass an exam. And the rational use of drugs is a very important part of that exam. And we monitor them for 3 months, and luckily, most of them, may I say, they do well. In 2000, in early 2000, we had more than 70% of our pharmacists and assistant pharmacists also expatriate. But thanks to the effort of my predecessors and the teams with him, now 70% of our pharmacists in the government are Omanis, and over 70% also of the assistant pharmacists. The importance of the proper use of medicine cannot be overemphasized. A health system can have all the latest high-tech equipments and specialization, but if healthcare providers and the patients do not use drugs or medicine properly, the effort can be wasted. Dr. Mohamed mentioned the unfortunate and alarming number that 50% of medicines are prescribed, dispensed, or sold inappropriately. And actually more than 50% of the patients fail to adhere to the proper taking of medications. I'm sure many of you are aware of the CDC report, which was published 1st of November this year, just this month. More people now in the US died from opioid prescribed drugs than cocaine and heroin combined. These are prescriptions. We, unfortunately, doctors have the license to kill, and some of us use it or abuse it. Let me give you an example close to my heart. I was practicing clinician, and I had this elderly lady, doesn't read Arabic or English. Mind you, she had a fancy handbag, and in her fancy handbag, she produced the medications. She had 5 different anti-inflammatories, given by 5, not 1, given by different doctors. She didn't know how to read, how to use them. Of course, with the term I used in Oman when I went back practicing with my colleagues, unfortunately, some of them, we have the term of buy one, get one free. They'll give you an anti-inflammatory, and with that, they'll give you either a proton pump inhibitor or H2 blockers. There was severe irrational use of drugs. Since the department was established, we had a consultancy before that in 1995 from WHO. 1996. And there were 4.5 drugs per prescription, and 60% of prescriptions included antibiotics. This study was repeated in the year 2010, and I'm pleased to say that at least the misuse of antibiotics had dropped. In the capital city, to 15% of the prescription only had no antibiotics, and in a remote part of the country, the southern part, it's still 37%, which is alarming. Rational use of medicine is now integrated into our health planning, with every region providing monthly prescription indicator reports. More than 32% of our general practitioners have been trained in rational prescribing, and more than 40% have been through the induction course. We have published national formulary and guidelines for doctors and nurses, and we aim and hope to have a clinical pharmacist for every 50 hospital beds. The obstacle in this, of course, finding training centers for our pharmacists. Our high-profile public education campaign means that the general public is also very familiar with the idea of rational use of drugs. It may take some time, but we are optimistic that the effort and the campaigns will be fruitful. As you will note from the presence, Oman is, as I said, a small country, but there are 11 people from the Sultanate here with 8 or 10 posters, and this showed the commitment from the high levels, the political commitment for rational use of drugs. Thank you very much for listening, and thank you for the organizing committee. Enjoy your stay.
Thank you very much, His Excellency. May I also take this opportunity to inform the audience about a very nice book prepared by the Ministry of Health of Oman. If you still don't have it, you can pick it up from the register desk. Thank you very much for sharing this great book with us as well. Now I would like to invite Dr. Anita Wagner, who is on behalf of the International Scientific Program Committee, to deliver his welcome speech.
Good afternoon. It's an absolute honor and pleasure to see each and every one of you here. It's wonderful to see you. Welcome to all of you here. Welcome to the friends and colleagues in Egypt. Thank you very much, distinguished moderators, distinguished hosts, Your Excellency, Dr. Ahmed. It feels like we are a big group of good friends. You go away from each other, you don't see each other for a while, and you pick up just where you left off. And that's how it feels, hugging many of you when we see each other here again after the 7 years, 7 months, and 7 days since ISIUM 2004. And for those of you who are new to this group of good friends, welcome to you, especially when you are here for the first time. The history of ISIUM started with several key colleagues of you here in the audience in 1997, where some close to 300 participants from some close to 50 countries came together and really set a milestone in the global agenda around use of medicines, and created what then emerged to be the joint joint research initiative for improving the use of medicines, which produced a body of innovative work that then was presented in 2004 at the second ISIUM conference with many more participants, many of you here are now back from some 70 countries, large amounts of material presented, and summarized in 25 very interesting policy summaries, an overall summary that was integrated into a World Health Assembly resolution and generated actually several post-conference research agendas and bodies of work that are now building a good part of the content that you have in those big abstracts books and in the form of the posters and in the form of the presentations that will be shared here. And so now here we are with some 600 participants, I think, from some 80 countries and an additional maybe 100 or so colleagues in Egypt, and a huge body of research, of knowledge within each of you and within the work that you're sharing with us to synthesize and to go forward in order to do what we intend to do, which is change for the better the medicine situation in the world with a particular focus on vulnerable populations. We're doing this in a context that obviously has changed. The world changes, and we have new challenges, but we also have new opportunities. Supposedly on October 31st, the 7 billionth person currently living on Earth has been born, so we have a largest ever living population in the world. With that, we have new challenges, increasingly aging populations who have chronic conditions, as we have heard before, non-communicable diseases, killing more people than communicable diseases these days. And at the same time, continued acute conditions, particularly in both of them being simultaneous challenges in most of the countries that all of you come from. At the same time, of course, we're astutely aware of the global economic crisis, of the widening gap between wealthy and poor people, and of the insecurities not only around medical care, but around the basic provisions of food. All of those leading to what we think is avoidable suffering and avoidable deaths. At the same time, however, we have opportunities, and opportunities particularly in the field in which we work. We have medicines, we have good quality, effective medicines that are actually not all that expensive in the big scheme of things, and as we have heard, we don't use them appropriately. There is innovation going on in areas where we haven't had very successful therapeutic strategies. There's innovation going on in cancer chemotherapy that is putting sort of a light at the end of the tunnel for patients affected by cancer, of which there are many, many more. There's an increased awareness that we're actually all connected, and certainly that health is a global issue rather than an individual, institutional, or national or regional issue only. And as we have also heard from our colleague from Turkey and from, as we know from other places, there is an increasing focus on thinking about the problems from a systems perspective. And we feel that the increasing movement towards universal health coverage in many places of the world is actually an opportunity for sustainably and scalably improving use of medicines, and we'll have several discussions on how to make this wishful thinking or hypothesis or belief actually reality over the course of the conference. And very firmly, I do believe that we do have opportunities to engage, and we have a realization that the problems that we are facing are so large that no single discipline, no single group of people, no single organization can take them on by themselves, and it needs multiple stakeholders from multiple sectors, from multiple disciplines to put their heads in their actions and together and engage in a dialogue so as to solve the problems that we are facing with respect to access, affordability, and use of medicines. So ISIOM is a milestone on this trajectory towards change. And that is really what it is. It's a milestone because truly very different from what I think my experiences with large conferences. And I think you already experienced it because all of you, we have put you to work already before you even got here. And we continue to put you to work as you are here. We are trying to achieve very definite outcomes by Friday and then build on those as a basis to go beyond. And what we are targeting is a synthesis of all the knowledge that you all have brought in your research work and in that you bring with you in your expertise. Synthesize that over the course of the next 4 days in order to come to a conclusion of what works and what does not work with respect to improving access to particularly use of medicines, particularly for vulnerable populations, particularly in low and middle income countries. Based on that synthesis of knowledge, we expect that we will be able to do two things, just like we did in 2004 and before, namely recommend evidence-based strategies for program and policy change that can be implemented now based on what we know by different stakeholders in the system, looking at the global level, the national, regional level, the institutional level, hospitals, health insurance systems, the provider level, physicians, pharmacists, nurses, and the patient community and civil society levels. Based on the body of knowledge, we also hopefully realize quite well what we don't know and embark upon the formulation of a new research agenda to create new streams of work to be implemented in the next 7 years to the next ISIOM conference, so that we actually increase the evidence based on which decisions can be made, to fill gaps in knowledge and especially adapt it to the continuously changing challenges and the hopefully continuously emerging opportunities. Particularly important for us is to evaluate in sound methodologies the intended and unintended effects of changes that we recommend. And then, of course, dissemination of the assembled knowledge here and in Egypt in this conference needs to go out to a wider audience. So please do keep that in mind as you are participating and contributing to the conference. Any strategies that you can recommend for disseminating the learning here so that actually action follows the thinking here. So this is how we have jointly with you all organized the conference. Today we are in the midst of the welcome addresses, and those will be followed by 3 keynote speeches by eminent colleagues on cutting-edge topics, and then later on by 2 sessions particularly focused on the medicines issues and the evolution of the pharmaceutical policy changes in Turkey over the past decade. And then tomorrow, Tuesday, Wednesday, and Thursday is each separated essentially into a morning and an afternoon session. And the way we have organized those is around these stakeholders in systems where we think actually who are in charge of making changes. So we have loosely defined the sessions around these 5 stakeholders, and then have on Thursday afternoon a special topics and methods session. And then on Friday, we're bringing all of the discussions and presentations together in the summaries for the conference and in the policy and research recommendations. The discussions in the conference happen in plenary sessions, but then they also happen in these 8 topic tracks, which have 2-hour sessions per day. And many of you have been designing the program in these topic tracks and will pursue the specific levels of discussions as to what can happen at the different stakeholder levels within your particular topic track area. In addition to the designed 8 topic tracks, there are key cross-cutting themes, which we believe and hope will come out of your discussions in most or all of those topic track discussions. One is an important one, gender and socioeconomic inequities with respect to access, affordability, and use of medicines. Another one is information technology and how can we harness the power of information technology for the purposes of improving medicines use. And another one is the topic of engaging multiple stakeholders actively and successfully for solving the problems that are ahead of us. This is how our daily schedule looks like. It's packed and exciting. We invite you to join us for early morning 1-hour sessions on some key topics. We then will try to summarize highlights from the preceding day in 15-minute summaries in this auditorium, just to sort of all cut across the discussions in brief highlights, because obviously we cannot all sit in all sessions. And then comes the first block of the day, the morning block, composed of a plenary session and the 8 parallel 2-hour topic track sessions. And then comes the afternoon block, again composed out of a plenary session and 8 parallel topic track sessions. And I need to make a plea here to you. This is admittedly a packed schedule. It has tons of wonderful information. It will only work if you are on time. So please do come on time to the sessions, and please do also, when you're presenting, structure your presentations as you have been guided by us within the time and slide limit that we have given you. We thank you very much in advance beforehand for doing this. I must also admit that we had an 8 o'clock moderator instruction session this morning, and we said very firmly to the moderators, if people don't respect the time limits allotted to them, you must cut them off. So please forgive us for being rude in that way, and thank you for adhering to time. I also want to mention another housekeeping issue at this stage. That is, we of course have been working on the program continuously, and at some point in time we needed to print it. So that preceded the finalization of the program. It has evolved since then. The most current printed version of the program is the small booklet. The larger booklet was printed earlier. And the absolutely most current version of the program is actually on the internet and will be on a blog every day. So please, if things are not completely consistent in your printed material, forgive us. It had to do with the constant evolution of the program. So, having gone through Tuesday, Wednesday, Thursday in the way depicted on the previous slide, on Friday, we will bring it all together. And what we will do in this part of Friday's discussion is having the topic tracks amongst themselves, and those of you who participate in them, cut across the 5 sessions that you have had and highlight the most important learning points, the recommendations you would like to make, you would make for change, and the recommendations that you would make for research, and have those summarized within topic tracks, and then prepare a presentation and share what you have done within your tracks with the whole entire audience. And then later on, we have the summary across all tracks and across all sessions be given again on the key lessons learned, the key policy recommendations and program change recommendations, and the key research recommendations that will be given by Hans Hoverseil and Martha Gjanser-Lutherrod and Dennis Ross-Degnan on Friday afternoon. And those, all of those steps on the way will help us to build the body of evidence that we are hoping then to move forward into action. Let me quickly talk about the structure of the topic track sessions. So these are 2-hour block sessions that happen after the 1-hour plenary sessions each morning and each afternoon, when you can separate into the 8 tracks. These are 1 hour of those 2 hours is allocated to presentations, and I need to please again remind those of you who present your work to try to do this, please, concisely, because the key parts of the sessions is actually the discussion amongst the presenters and the audience in order to define the lessons learned and the recommendations that we want to get out of it. And for that, we need to have enough time allocated for discussion. Because our focus is really on generating a body of sound evidence that can inform decision making, we also pay attention to methods, and we have 8 important and exciting method sessions that we're offering on Thursday and Friday. 4 of them happen parallel at each time slot. We invite you to choose what is of most interest to you. And in addition, the early morning sessions target these topics here: access to medicines, the right to health, innovative high-cost medicines, a key issue, the polypill debate, and insurance coverage and the perspectives on pharmaceutical industry. We invite you to join those at the early morning hours. Each session, early morning sessions, method sessions, track sessions, plenary sessions, will all be summarized. We have a structured reporting system, and we have, many of you have kindly agreed to moderate in a way that the discussions focus on creating this output, and then to summarize the output from each of the sessions in these key observations, key recommendations, and key research questions. We do that by way of an electronic summary tool where the rapporteurs will enter these observations by each evening, so that we have actually a repository of the learning that is going on every night. And that is actually important because we'll use it for a number of purposes, which I'll mention in a minute. But in addition to that, because we know that there's little time for everything that we have to discuss, and because everybody has different levels of comfort in terms of speaking up, we invite you very much to make use of this particular website that's listed here and will be posted on the bulletin board, to share your thoughts on a particular topic. If you've been sitting in a session and you think, oh, I have a recommendation to make, or I know of a piece of evidence related to that, so please go online and in brief words, bullet form, concisely, add your recommendation or your observation or your thought to this particular, to this survey tool that's on this website. The entries that are being made into the formal reporting system will be reviewed every night, and at least 3 things will happen with them. One, a summary will be made that will be shared next morning here in the audience of the highlights. Secondly, a summary will be posted on the ISIUM blog, for which this is the link here, which will also have the most updated daily schedule. And thirdly, the information that's on that in those structured reports will help the track teams to synthesize their reports for the last day and the overarching summary presenters to produce their overarching summary. So those of you who are entering information in that system, we are very, very grateful for you to produce these summaries, because they are the stepping stones for us on the way. The stepping stones for actually after ISIUM, where we see our work to really begin. We're intending to produce topic summaries on key topics, both within the track-specific topics as well as the cross-cutting topics. We'll produce a conference report, and all the information that you have brought to this conference, the posters, the oral presentations, the summaries, will be on a web-based archive, which is probably going to be, I would think, the best state-of-the-art summary of the evidence of what we know in this area of medicines, as it will not be, in just one journal or in other place. I think this will be the repository. And that we will then try very hard, and again need your help to do so, to make that information be part of action, of decision making within networks that you are part of, with advocacy to international organization, and importantly for implementing research streams to answer questions that we know we have no answers for right now. With this, many, many, many thanks to everybody who has made this possible. It's just mind-boggling to be here now after 18 plus months or so of preparation, and you all have been such a part of it. I can't possibly name everybody who has made this possible. I want to give some special thanks to the 2 colleagues in the core scientific team in Boston, Catherine Valentin, who not only has written 822 messages to John, but probably 8,000 some odd messages to all of you. And thank you. Without Catherine's expert organized help, I don't quite know where we would And then, of course, Dennis, who is the heart and soul of the history of ISIUM conferences. Thanks very much to you, Dennis, for your guidance. And what happened to my slides? Do we have them back? Many, many thanks to John and Keith and Louis in the organizing committee. Who also, Louis, I don't know how many, I don't know where you are, but I don't know, 1,500 messages to John. I know, 5,000 to the rest or so. I'm not quite sure how you have not exploded your email inbox. The colleagues in Egypt who have done a tremendous amount of work to get the conference ready in Egypt and then shifted gears generously and graciously to continue to support the work here in Turkey. We thank you here in Turkey for hosting us on such short notice with such expert advice and hospitality. It's tremendous. We are very grateful to the sponsoring organizations and the donors who have made it possible for many of us to be here together. The support from and the absolute attention to detail from Via Tours is visible to you everywhere. And if you haven't looked at your sleeve of your hotel key card, take a look at it. It's an ISIUM sleeve. And then, of course, you all are making this really possible. It's your brains, your expertise, your hearts, and you're going forward to set the tone and to make a change. We thank you very, very much, and we hope you'll enjoy Antalya and enjoy the conference, and particularly enjoy each other's company and the fruitful exchange of knowledge. Thank you.
Thank you very much, Anita. We are just on time for this session, and I think this is a good sign for the rest of the conference.